So thank you for doing this. This month has been designated as Prescription Drug Abuse Awareness Month now for 5 years. And I remember going to visit with then Senator DeSaunier to ask him if he could help us get the word out better than it was at that time by designating this month. And it was just meant to be for 2012, March 2012. And so we put on an event and had a lot of different activities, but having the ability to have the month highlighted in the way that we did that year was great. So at the end of the year, of 2012, I went to visit with then still Senator DeSaunier, and I asked him if there was any way we could make this permanent. You know, I don't want to come see you every year. Let's just make this permanent. No, we still saw each other, but anyway, and there was no hesitation at all. It was amazing. So, bottom line is, I just want to thank you for my organization, for me personally, for everybody here, for the whole state of California for doing what you did. By May 2013, that month was permanently designated. We had legislation that went through the process, and it was signed off by the governor. So, thank you. It is amazing. We have this event, and this is our 4th annual Dose of Awareness event. We started out in San Ramon for the first 2 years, moved it over to Concord, and now Walnut Creek. And we're not the only thing happening in the state. So I want you to know it's grown, not this event specifically, but we have a lot of other organizations out there doing things this month. So it is kicking off. It's taking a little time, but people now will say, yeah, I know it's that month and we're going to do this or that. So it has had lasting value. So I just wanted to give you an opportunity to kind of reflect back and talk about your perception of that time frame and how things were back then compared to now. Are we making traction from your perspective? Now you're working at the federal level, and so you supposedly have more clout now.
Yeah, no.
Anyway, I want you to just say a few words about that, please. Thank you.
Well, first of all, can we have a round of applause for this amazing person? Years ago, I was having, on Saturdays, we try to, once a quarter at least, since I was mayor of Concord, which was a long time ago, child was not on this earth, but a lot of you weren't on this earth, but we do what's called mobile district office hours. So we were in San Ramon, which was part of my Senate district then, and I got to know what April had lived through when her surviving son came and told me the story of Joey and what happened to Joey. With Joey's story, and then another great Contra Costin, Bob Pack, who lives in Blackhawk, who's been just a remarkable, like April, advocate, because he lost children as well because of the opioid epidemic early on. So one of the nice things about being in elected office, you meet many wonderful people for a variety of reasons. This one tragically, but out of that tragedy, April and Bob and others, many of you have done something about it. So in the United States of America, in 2016, memory serves me, 116 Americans die of opioid abuse a year. It costs the United States of America over $500 billion a year because of opioid abuse. We have a little over 4% of the world's population, but the United States of America consumes over 80% of the opioids in the world. If you read books like Dreamland and you do a little investigation on this, unfortunately, the makers of this product have profited, and we're now aware of that. They've targeted places like West Virginia, places where they know that there's a lot of manual labor and people are going to have injuries. So Congress is working in a bipartisan way. When as tragic as it is here, you look at other parts of the country, New Hampshire, parts of the Rust Belt, just horrible. West Virginia, as I mentioned. So we did add $3 billion over what the president asked for in the omnibus that we passed last year. So that's good. I work in a bipartisan way with a colleague, Buddy Carter, who is a leader on this issue on the other side of the aisle. He's a pharmacist, and we've carried 2 bills. one which would require interoperability in prescription drug monitoring systems. So in California, because of Bob Hack in April, I was able to get a bill through that put $5 million into the Cures system to make it real-time information. And we worked very in a partnership with then Attorney General Kamala Harris, now U.S. Senator Kamala Harris, and we're working with her to do other things. So one of our bills was said, as other states come up to our technological level, that it'll be interoperable so that everybody can share this information, which is important because, as we know, a lot of these products move across the country, and where there are weaker restrictions, unfortunately, people go and buy them there and bring them into other states. Florida, notorious for this, for what's called pill mills. And then Representative Carter and I have another bill right now that would add, I think, about $20 million so that we do best practices to make sure pharmacists know and can recognize when people are doctor shopping and use the Cures system, so they also know their responsibility to stop it as much as possible. So with all of those things, but it's really, it's amazing to talk to colleagues from around the country and become more familiar with it, and of course starting here and meeting with public safety people here from the district attorney's office, from the attorney general's office, and around the country, what an epidemic this is. So I feel gifted to be part of this, and I just feel very grateful to all of you for being here, but particularly to April and to Bob Pack. They're remarkable friends, and they've taken a great tragedy in their personal life and helped change the whole country, and she's a national gem, and I just want to say thank you for you.
Well, I just want to point out, let me just ask this question. How many out there have been impacted in whatever way? You know people, you have family members, friends, or whatever. Look at the hands we have raised. We've got to break down stigma, and being here today is helping to do that. As we walk the track, hopefully most of you will do that. We're wearing our shirts, we're hopefully holding signs up, whatever you have. We've got to break down the stigma because that keeps us from getting appropriated money. And it's like nobody wants to talk about it, So stand up, talk about it, be here, you're here. I love that. This is the biggest group we've had so far, and I didn't know if anybody would come. Every year we kind of wonder, but here you are, and I appreciate that very much. I also want to say this isn't all just about me, so thank you very much, but we've got a lot of troopers out here. This event is actually co-hosted by 3 organizations. One of them is mine. The other one is the Alameda Meds Coalition. And so I don't know if the supervisor is here. There you are. So Supervisor Miley has been an amazing supporter of his coalition. And in fact, we'll have Dan Ashley talk about what contributions. I won't steal his thunder. And then the other coalition is the Men's Coalition from Contra Costa County. So we are all working every single day out there to do everything we can to prevent prescription drug abuse and heroin abuse, so we don't have to deal with the horrible downstream impact from it. Addiction, which I'm sure many of you have come into contact some way or somehow with. It's horrible. It takes families down, and it's not just the individual, it's the whole family. So that being said, thank you for being here. We have wonderful sponsors and exhibitors. Go visit every single one of them. This is an educational event. We want you to learn from it. I learn something new every day, and I've been immersed in this for 8 years, so I'm sure you can learn something too. There's lots of other treatment options and all sorts of things you can take advantage of. So I want to, again, thank you, but I'd like to call up Senator...
No, go ahead. I was going to point out Karen Mitchell.
Oh, she's going to come up and speak. So I want to have Dan Ashley. I don't know where you went. Dan Ashley. There you are. Thank you. So Dan Ashley, the last 3 years of our event, we have had Cheryl Jennings from ABC PGO News. She isn't able to be here. She just had some surgery again, and hopefully it's healing well. But we are so blessed to have you, Dan, here with us today. Dan has been in the business for so many years, 25, 30 years.
32.
I hate to say.
Careful.
Yeah, I know, you can get into trouble for that. But anyway,
Why do you want to get into that?
Anyway, bottom line is, he's done everything. He's had multiple awards. He is so passionate about many causes. I did a bio thing on you, and I saw how many different nonprofits you support as board members or whatever, action you're involved in, and I thank you for that. Every one of his nonprofits need help, and you're a big name and a big star, and you can bring a lot of attention to it. So bottom line is I want to turn this over to you so you can get our guest speakers coming in, and we'll get through that and get on our walk and visit. So thank you so much.
Thank you, April, very much. Give her a big hand for what she's done. And thanks to Mark, a dear friend, an old friend, and he does such great work in this community and for this country, so give him a big hand. He's really on the front lines for so much. I just want to say very quickly, it's a great privilege. Cheryl Jennings sends her regards. She could not be here today, but it's really an honor for me to be here. You know, one of the great things, forgive me for being sappy, but you know, this job allows me to have a unique place in the community for which I'm deeply grateful. So the chance to be involved, and when people call and ask me to do things, how can you say no? It's very humbling and very flattering, and I'm honored. And especially since I live practically across the street. But anyway, I'm really glad to be here today. You know, we've all had personal stories around addiction issues, particularly opioid addiction issues. I know there's a member of my extended family who had a horrible time, and we thought this young man was not going to survive. Fortunately, he did survive. He's not out of the woods yet, but we all have these stories, and it is such a crisis. You know, there's so much debate around the country now about things like legalizing marijuana, and yet such a drug, some of the other drugs that are out there that have been legal for years, they have many benefits, but they have many, many drawbacks and many, many dangers. And as Mark said, so many communities around the country are absolutely devastated. And I've been to a couple of these places. We've done a lot of reporting on this issue. And when, you know, we're fortunate here in the Bay Area. It's bad in pockets, and we all have issues. But in some communities where the economy is absolutely collapsed, it's just absolutely, utterly devastating. So I commend all of you for being out here today and supporting this great cause, whether you have a personal connection or just a deep sense of compassion to help address this issue. It's wonderful. And aren't you glad we didn't hold this yesterday when it was cold and rainy? One of the things that we want to do with this event is expose the problem, pull the curtain back, and talk about it. There's nothing to be ashamed of here. This is an epidemic and a problem that is affecting our friends, our neighbors, and our families. No reason to be shy about talking about this. So all of our speakers are going to be very candid with you and share their stories. I'm going to bring up first the mayor of Walnut Creek, Justin Waddell. After serving on the Walnut Creek City Council since 2012, he was recently elected as mayor, so we're going to ask him to come on up. He's doing great work here in this city, and I want to give him a big welcome.
Thank you for everyone for being here today. Like all of you, I know that drug addiction and drug abuse has afflicted far too many of our communities. In fact, 771 of our fellow brothers and sisters have died since 2006 because of this issue. None of your families, none of you as an individual are immune from this issue. My own family has been afflicted. For most of my life, my uncle has actually been homeless. And like far too many of these individuals, he's been engulfed by the drug epidemic in our society. But my family made a dedication, not only to ourselves, but to him, to improve his situation. And while he's recently seen drastic improvements, we know that the battle is not over. That is why it's so important that we educate our children, and really all of us at every age, about the impacts, the adverse impacts of drug abuse, prescription and over-the-counter or otherwise, that we teach everyone how to dispose of unused drugs in the proper way, like we have here today or at most city halls, and that we lock up our drugs to ensure that only those individuals that need them are actually taking them. It is so encouraging to see all of you out here today. I really appreciate it. The City Council appreciates it, and those impacted by this issue appreciate each one of your efforts. Thank you so much.
Yeah, it's so important to know that our public officials, like the mayor, are really actively involved. They are in so many ways on the front lines of this issue, just like Congressman DeSagne. They're on the front lines of this issue trying to find real solutions. One of those solutions that our next speaker will talk about is Contra Costa County Supervisor Karen Nitchoff, who's going to share a few words about the medication disposal ordinance recently passed by the Contra Costa County Board of Supervisors and why that is so important. Karen, if you can come up and share a little bit about that.
Good morning, good afternoon, I guess, everyone. How are you? Thank you again for all coming out. Yes, the county, because of April's leadership, and Patty's here somewhere, there's Patty, and others, but they come every year and we do the same type of thing. We do a resolution honoring the work that you're all doing and highlighting not only the individuals behind us listed here, but those who are currently involved in this terrible addiction. So the county did an ordinance, and unfortunately right now we only have jurisdiction over what we call unincorporated Contra Costa County. But come this June, every pharmacy in unincorporated Contra Costa will be obligated to take back your prescription drugs when you are no longer in need of them. Yes, we're proud to be a leader on that, but we're more proud that we got the drug companies and the pharmacies to take ownership of this issue, because as you all know, I mean, maybe you haven't been exactly impacted by the opioid epidemic, but I have an elderly mother and she takes a lot of prescription drugs, and when she's finished with them, we don't want you putting them down the toilet or the drain. Lindy Lavender is here from Central Sam. Thank you. Lindy used to work for both me and Mark. And that is one of their key messages. Don't throw it down the drain. And so we want you to take it back. And we are hoping, a lot of you are here representing Walnut Creek, but other communities, take it back to your city councils. When I say it's a model ordinance, it's just don't reinvent the wheel. You know, you can tweak it for your own community. But we encourage you to go back to your city councils and ask them to adopt similar things, so that every pharmacy in Contra Costa County will be required to take back those meds once you no longer need to use them. So again, thank you for everyone being here. Have a great walk, and it's a good day to get out there and burn some calories.
Thanks, Karen. I want to acknowledge someone else who has just arrived, who's also very, very involved in this community. She's a good friend and a leader in Danville. She had her time in Danville as mayor. Now she's gone back to council. They rotate like we do in Walnut Creek. Give it up right there. Raise your hand for Renee Morgan. Our next speaker is Alameda County Supervisor Nate Miley. Served in District 4 in Alameda County for the past 15 years and led an effort to pass the first safe drug disposal ordinance in the country that requires pharmaceutical companies to pay for disposal of unwanted or expired drugs. And you should know the county was sued over this, and ultimately the U.S. Supreme Court upheld that ordinance. Nate has been a real hero in this fight and is going to share why he believes this event is important and what each of us can do to make a difference. Nate, good to see you.
Good morning, or good afternoon. Seems like it's morning, but it is afternoon. So it's really great to be out here in support of April and others. Thank you, Karen, for welcoming me to your county, and the congressman as well. I knew him when he wasn't a congressman, and he's still approachable, and I like that. Yes. So yes, Alameda, we passed an ordinance around 2012, and we were sued. The pharmaceutical industry said that they would bankrupt the county. We were requiring that the pharmaceutical companies take responsibility for their products at the end of the life cycle when people either no longer want them or they have expired under extended producer responsibility. And the pharmaceutical industry, they've got more money than God, but we stood up to them, and our ordinance was mirrored in other counties, not only in this state but throughout the country, paved the way for that. And I was very pleased about that because older adults, young people, basically educated me around this issue, how pharmaceuticals could be abused. Before I got involved with this issue, and I've been a county supervisor for 18 years, I thought you could just set your medications out, let the waste hauler pick them up and take them away. People said, no, somebody might want those drugs. And I said, really? And that's how naive I was. So we felt it was important that we pass an ordinance so that people could conveniently and properly dispose of their medications just like they're doing here in Contra Costa County at pharmacies, law enforcement facilities. Presently, we have nearly 40 locations throughout the county where people can drop them off conveniently. We need many, many more. We've done a lot of struggles around this. We want to make sure, as Supervisor Bischoff pointed out, that people properly dispose of these, don't put them down the toilets, don't hold on to them so that young people can get them out of the medicine cabinets, have farm parties. Don't, seniors might get confused and use them. So it's a public safety issue, public health issue, public and environmental issue as well. And we have the support of law enforcement. I really appreciate law enforcement. They're out here in recognition of all the work they do around this issue and many, many other issues. So a lot's been done, but a lot more needs to take place. And that's why this type of event is important, to continue to raise awareness about this. Because in the pharmaceutical industry, if they had their way, people would just take their medications, either leave them in their medicine cabinet or put them in coffee grounds or tea leaves, things of that nature. That's how they kitty litter. That's what they told us folks to dispose of their medications that way. And that's not appropriate. It's not good for the environment, for one thing. So I really appreciate April and her stance on this. And we know that as a result of the death of her son, which is real tragic and unfortunate. And we really don't want to see that happen again. So these type of events help to raise that level of education, that type of awareness. And so we're going to continue to stand with April, the Men's Coalition in Alameda County, continue to push and honor events such as this. So thank you all.
Good work. Thank you, Nate. As Nate said, he mentioned law enforcement. They work hand in glove with law enforcement, and to that end, another good friend and someone who really sees this firsthand. I want you to welcome, please, the Chief of the Walnut Creek Police Department, Tom Chaplin. Tom, come on.
Hey, good afternoon. What time is it?
It is 1:25.
It's 1:25. 116 lives lost every day to opioid overdoses. 116, that's one every 12 minutes. In the time we've been standing here, 2 lives in this country have been lost. Just to put in perspective this devastating epidemic that's going on. I've written some notes so I don't forget anything, so if you'll indulge me. I want to give a special thanks to our partners in this effort to educate the community. The coalitions hosting the Dose of Awareness event, including the National Coalition Against Prescription Drug Abuse, specifically Executive Director April Rivero, the Alameda County Medical Education and Safety Disposal, or MEDS Coalition, the Contra Costa County MEDS Coalition, our local partners at the Center for Human Development, and the Discovery Counseling Center. Can we just give all of them a big round of applause? The opioid epidemic has swept the nation. Even in a beautiful community like Walnut Creek, we're not immune to the tragedies of addiction and overdose. Between 2008 and 2016, there were 769 deaths in Contra Costa County attributed to opioid overdoses, 40 of which occurred right here in Walnut Creek. The tragedies associated with opioid addiction know no boundaries and affects families and communities of all demographics and socioeconomic status. Many of the victims of opioid addiction become so through no fault of their own, often a result of physical injuries or medical conditions that were treated with prescription pharmaceuticals and developed into addictions. These are our sons, our daughters, brothers, sisters, husbands, wives, and neighbors. These are the names we're seeing on the back of people's shirts. These are the pictures we're seeing on the front of people's t-shirts. These are real people and real families that are devastated, whose lives have been irrevocably changed due to these losses. Many victims of addiction are kids or young adults who start out experimenting and falsely believe that if the drug comes in a pill and is prescribed by a doctor, it must be safe. The epidemic that has resulted from prescription drug abuse has swept the nation and devastated communities and families across the country. And let me tell you, if you were talking to a police chief on the East Coast in certain parts of the country right now and you ask them what the #1 public safety issue confronting their community is, this is it. Now that's not here yet, and we're going to make sure it doesn't get here with the good work and education of people like you. According to the U.S. Department of Health and Human Services, 80% of heroin users reported misusing prescription opioids prior to heroin. In law enforcement, we know that a byproduct of addiction is increased crime, particularly property crimes such as thefts and burglaries. Our #1 job as police officers is to make our community members and businesses feel safe by protecting them and their property. By addressing addiction, we are directly addressing one of the root causes of crime, and as a result, it is of great importance to the entire law enforcement community. I'm proud to announce that earlier this year, the Walnut Creek Police Department officially rolled out a naloxone program. I imagine that most of you here today are very familiar with naloxone, also known as Narcan. But for those of you that are not, it is an opioid blocker that temporarily reverses the effects of opioids on persons suspected of overdosing. We have now trained all of our patrol officers on the use of naloxone and equipped each of them with this vital medication. We even keep some within the police department in the event that one of our own officers accidentally comes into contact with a potentially fatal opioid such as fentanyl. I'm proud to say that as every uniformed officer walks out of the police department to patrol their shift, they now carry a tool that potentially has the ability to save a life they didn't have just last year. It is only through events such as this Dose of Awareness Walk and the work that is being done through the National Coalition Against Prescription Drug Abuse that we can hope to bring awareness to the dangers of prescription drugs. The Walnut Creek Police Department is committed to partnering with coalitions and community members to raise awareness and do whatever we can to prevent even one more death. It is vitally important that we educate students about the true impacts of opioids and kickstart life-saving conversations in the home and in the classroom. I want to thank all of you for joining us today, and I especially want to let you know, for the people that have suffered these tragic losses, please know that we grieve with you, and that these losses are not in vain, but you in turn, by being here and by work of people like April, are educating people, and you are going to save lives by your efforts. Thank you for being here, and thank you for your commitment to this cause.
We'll give the chief a big hand. I mean, he is really doing everything he can from a law enforcement perspective. That's true community policing that he's involved in. Way to go, Tom. We appreciate it very much. And to talk a little bit more about the naloxone is Polina Gervitz, the hub and spoke coordinator with BART programs. And that's not the BART that takes us from here to the city. That's the BART with 2 A's. It takes people from addiction to recovery. And a very powerful group of programs. Please welcome Polina to talk a little bit about that. Thank you.
Hello everyone, my name is Polina Gervitz. I'm from BART programs. We're all over the world, but our clinic is in Antioch, California. So I'm pretty sure we're all aware of the opioid epidemic that's going on. And after all, BART is a recovery center for individuals who struggle with opioids. But most importantly, I will be speaking about naloxone kits and Narcan. So it does treat opioid overdoses, and we are going to be offering naloxone kits to each patient that comes into our door. And on top of that, we're going to be offering it to any individual who walks into our door with our federal funding, because we believe in having these kits at each home. And if we can get these kits in each home, it can prevent an overdose. So if you guys are interested, we do have these kits at our facilities. We should be getting them within a month or so. We actually are going through the training of all of our staff members. And moving forward, we will be trying to collaborate with as many individuals as we can. As you will see, I'll be going around to each table to get contact information, because we do have federal funding, but I want to collaborate with every individual as we can to move forward to prevent opioid addiction and overall the epidemic. So I want to thank April for this, because we will be moving forward and collaborating together. Thank you, April.
Very quickly, we'll move things along. Let me recognize a couple of people who also were kind to come out today, and it's so important that these folks are here because they really are helping make decisions that make a big difference in this fight. Walnut Creek City Council member Kevin Will, give it up for Kevin. Contra Costa County Supervisor Candace Anderson, thank you Candace for being here. And once again, all of you for coming out today because this is a really successful event today. We have such great turnout. Next, we're going to get to the 5K walk. Who's ready to walk? We've done a lot of talking. You ready to do some walking? Okay. The Free Health Expo is open now through the end of the event, so please avail yourselves of some of the great resources and material. They have handout material, so you have contact information to take with you that I think can be very valuable for you or family members or people that you know. Please make sure to stop by and see these exhibitors because they were trying to come out here today too and set up and make sure that they were here. Now what we're going to do is start the walk. The walk path is around the perimeter of Heather Park. How many of you have done this walk before? Raise your hand. Okay, those of you who have not done it before, you're in for a real treat because I walk this route a lot and it's just beautiful. Walk monitors will be positioned in several places along the path. They will make sure that you're safe and know where you're going. There is a cutoff about 1 mile into the trail for those who don't want to walk the entire 5K route, so you have a chance to bail if you like. And a walk monitor will be there to point that out to you. Important, photo paddles will be available at the entrance of the track. We ask that you take one and walk the route with it in memory of that person lost to the epidemic. That'll make it even more meaningful for everyone participating today. Now, Crunch Walnut Creek will lead a warm-up exercise because you've been standing still, right? We don't want anybody pulling a hamstring or anything. So we're going to get you good and warmed up, and we're grateful for Crunch Walnut Creek to do that. They're going to do that just over there around the corner. And the raffle drawing will be done at 2:45. You must be present to win. So if you want to win one of these great prizes, please stick around a little bit after the walk. $1 each or 6 tickets for $5. So if you haven't bought a raffle ticket yet or a handful of them, please do so now and take part in the raffle and help us raise a little money and maybe you'll win something. And we want you to stay at the end for the Loved Ones Tribute where we will have very special activities in memory and support of loved ones who are affected by prescription drug and opioid addiction and this terrible epidemic that we are here today to help find solutions for. Now, we're all going to head back there where the balloons are to get ready for the walk, and Crunch will get you warmed up. Have a great walk. Give yourselves a big hand. Thank you for your kind attention today. Thank you for being here. Have a great time out there in Heather Park.
Hey, we're just almost